Insurance expert Brenda Gilliam reveals the myths and misconceptions about U.S. health insurance for the working class on Influencers Radio. Brenda Gilliam, the founder of Gilliam Insurance Advisor, was the featured guest on Influencers Radio with Jack Mize. There are a lot of myths and misconceptions about health insurance in the U.S. It can be confusing and frustrating to make sure the right coverage is in place. The Affordable Care Act is misunderstood by many, and a lot of people think that getting insurance through their jobs is the only cost-effective way to go, which is often not the case. On a recent episode of Influencers Radio with Jack Mize, insurance expert Brenda Gilliam discussed the biggest myths and misconceptions about health insurance. During the interview, Gilliam explained how the perceived cost of health insurance is a common obstacle that prevents many from being covered, saying, "One of the biggest myths is that people feel like that they can't afford insurance because when they've checked on it in the past, they've just got very high monthly premiums. So they just throw their hands up and kind of give up on it, thinking that they can't afford it. And if they're on Medicare, sometimes those people will hesitate to add the Part B because of the premium they have to pay. They don't know that there are special programs in place that can help people pay their part of the premium, which makes the health insurance affordable. They just need a good source to go to for the correct information." Gilliam went on to dispel several other myths and misconceptions when it comes to insurance options for the self-employed, workers leaving jobs with insurance plans, and those approaching retirement. When asked what fuels her passion for helping others to navigate the insurance maze, Gilliam shared her personal story, saying, "My mother had Medicare, and she just did not understand how it worked. She was one of those that thought, 'I've got my Medicare, now I'm covered.' She didn't realize that she needed to do something on that other 20%. She was diagnosed with a serious illness and was referred to a specialist who told her that he could cure her condition, but that she needed to pay upfront, and I think that he wanted somewhere around $12,000 or $13,000. My mom didn't have that, so he just sent her on her way. Her illness progressed, and I ended up losing my mother. It was devastating to me, but also to the whole family. When I really got into what happened, I didn't understand insurance at the time that this had happened to my mother. I realized that it was because she didn't have that other 20% covered. But she could have had it covered for nothing had she only been educated about it, and she would probably still be with us today. I realized that my mother is not the only one that doesn't understand it, and I don't want to see that happen to anyone else. So that's when I decided I was going to switch from being a science teacher, and I started educating and being a teacher of insurance, particularly Medicare, and how important it is to get that 20% covered. If I can prevent any other person from having to go through what my family had to go through and what my mother had to go through, then that makes it all worthwhile." Today, as the founder of Gilliam Insurance Advisor, Brenda is helping the working class, as well as the retired and semi-retired, navigate the maze of choosing the right option for themselves and their families. Listen to the full episode. Learn more about Brenda Gilliam and Gilliam Insurance Advisor. Visit link